Public health is the special source that is all around us, that is keeping us healthy on a day-to-day basis.
Essentially, it's about stopping bad things from happening, if you want to put it in its simplest possible terms.
Public health is prevention over cure.
Improving population health equitably.
Hello and welcome to Public Health Is, a podcast from the Public Health Association of Australia. I'm Paris Lord.
And I'm Dr. Stephen Owen. Public health is based on evidence, and we're bringing you this special edition of the podcast to talk about the Australian Institute of Health and Welfare's National Drug Strategy Household Survey 2025, which was released last Friday, the 17th of July. And this showed a continuing decline in rates of smoking in Australia.
Today our guests are Professor Michelle Jongenelis from the University of Melbourne, who's also co-convenor of the association's Alcohol, Tobacco and Other Drugs Special Interest Group. And we're also joined by Laura Hunter from the Australian Council on Smoking and Health, otherwise known as ACOSH.
Welcome both. Thanks so much for joining us today. We'll get straight to it. Laura, can you talk us through the report and some of its significance?
Absolutely. We're seeing some really good news from this report, and we're seeing some warning signs, some alarms that we need to be really, really aware of. So firstly, the good news is there are fewer smokers in this country than there were 5 years ago, and that's a massive win for our sector, for the community. But we're also seeing in this data some interesting stories about the illicit nicotine market. What we're finding is that people who are consuming these products are far more likely to be consuming multiple forms of those products. So think tobacco, vapes, nicotine pouches all at the same time. And that's a huge concern. These products are highly toxic, they're dangerous, and we need to crack down on the illicit nicotine market.
Professor Jongenelis, what was your reaction? You've been studying this area for quite some time. What was your reaction when you heard about the numbers?
Yeah, really, really pleased with the numbers. But as Laura's pointed out, there are still some concerning data points in there that we need to be thinking about in terms of the future of tobacco control in Australia. I guess my first concern was, oh gosh, I hope this doesn't mean that everyone thinks tobacco control is done and we can just stop. We're nearing the 5%. We've almost reached that end game, as people would call it. We can sort of backtrack on things. So that was my first concern. So it was sort of really important that we emphasise that tobacco control isn't done, that 66 Australians and people's loved ones still die every day from tobacco-related diseases. We've obviously now seen, some concerning findings with nicotine. If anything, now is the time we really come up and really change the way that Australia looks at tobacco and nicotine and do more rather than less.
So one of the things that I've noticed straight off the bat was a fair bit of skepticism of the data in the AIHW report in some parts of the media and, for my sins, in a lot of the comments on Facebook that I've been looking at. A lot of skepticism in relation to the ABS wastewater analysis, which was published a month or so ago, and these seem to be somewhat contradictory in some ways.
The two surveys paint a really interesting picture of the illicit market and what is happening in tobacco control across this country. So it shows that the survey released on Friday shows a reduction in smoking prevalence. But given the illicit nicotine market, given one vape can contain the equivalent amount of nicotine that you would get in 9 packets of cigarettes, the ABS wastewater data last month showed increasing consumption of nicotine. So the nicotine in our wastewater is not indicative of smoking prevalence. Yes. And so when we think about these two surveys together, what we're seeing is a reduction in smoking prevalence, but an increase in nicotine consumption and a call to action to tackle that illicit market as a matter of urgency.
I completely agree. I actually don't think that the reports are as contradictory as the industry would like us to believe. One report, the ABS report, measured nicotine in wastewater. They then adopted some experimental modelling to try and extrapolate from that illicit tobacco use and NRT use and vape use. Again, that was an experimental modelling study, whereas the AIHW measures, as Laura has pointed out, smoking rates and vaping rates. And what we're seeing with the AIHW report is that there's been a doubling in the number of people who are consuming more than one product, right? So they're now consuming 3 products. They're consuming pouches, they're consuming vapes, they're consuming illicit tobacco, snus, any sort of nicotine product. People are now more likely to consume 3 rather than 1. And so In actual fact, when we think about that compared to the ABS results, it makes sense then that the ABS is seeing an increase in nicotine and wastewater because people are consuming more nicotine. And the nicotine that they are consuming is from those illicit vapes that can contain, 50 milligrams, if not more, of nicotine per, product that's sold.
We saw some of the Sunday papers reporting that studies led by University of Wollongong researcher Jody Muller was identifying some vapes have the equivalent up to 625 cigarettes in them. What was both your reactions to hearing about this and then also news from Friday that the Australian Health Minister Mark Butler has directed the Therapeutic Goods Administration to stop providing nicotine pouches as a therapeutic?
It's not surprising that the industry is coming out with these newer products and that they're adopting the latest technology to make sure that those products do contain really high amounts of nicotine. So the results that came out on Sunday by the independent investigation that was done by one of the media outlets, it didn't overly shock me that these products are containing high amounts of nicotine because that is exactly the industry playbook. And it just goes to show sort of how important it is that we continue to enforce the laws and that we go in and we shut these retailers down who are selling these highly addictive products to young people.
I think as well, when I was talking to a lot of media groups on Friday about this, they were shocked to hear the potency of some of these products. And it does tie in to the ABS data and what we're seeing about nicotine consumption. But I will say that, it's not an accident that the tobacco industry is trying to addict new people to their products. It's not an accident that they sent out a media release to media without it being on their beautiful smoke-free world website, which just discredited everything that was talked about on Friday. And I think that what we need to be very aware of is that the call to action is always the same at the moment, right? The call to action is that young people are accessing these illicit nicotine products through bricks and mortar stores. We know that from Generation Vape study by Professor Becky Freeman. And so the call to action from this sector and from public health groups has to always call for shutting down these bricks and mortar stores who are doing the wrong thing and breaking the law. Now, that is a bit of a state and territory issue because states and territories have the licensing schemes to manage and enforce the law around tobacco licensing. However, the states and territories are also needing to get better funding and more funding by the federal government to actually resource that kind of enforcement. So at the moment, it's quite short term. Some of those contracts are, 12 to 18 months. And you think about if every state and territory was to build up a solid enforcement team within each Department of Health, that they need longer term funding in order to build those salaries, those staff, those teams. And so one of the calls to action that we have as well is around the federal government actually putting more money, substantially more money into supporting the states and territories to do that enforcement as well.
And listeners should also be aware that some of the states, Victoria, for example, have only just in the past 2 years enacted legislation for tobacco licensing. So even though these products have been legally available for decades, actually calculating the numbers of who was able to sell them is very new.
Absolutely. I remember being in a Senate inquiry recently and they said this was before all the licensing started to lift off in these states. And I remember doing the calcs and saying, yes, we have an illicit trade issue. And actually 77% of the population of Australians live in states where there's no licensing at the time. So that's changed. And so, while we give them a pat on the back and say, well done, that's great. At the same time, we also say, enforce those licensing schemes, make sure they're tip-top shape. And Victoria now has a huge suite of measures that are going before the Parliament in August. I'm hoping they pass in August. And so that's really good. So does Tasmania. We need the territories to lift as well with the Northern Territory and the ACT. But as soon as we start, we're seeing momentum, we're seeing movement, and this cannot be solved overnight. This cannot be solved with a silver bullet. There's no magic thing that's going to make this disappear. So we need to stay the course, and we're seeing momentum, but we need to keep pushing really hard on this.
The thing to note with Victoria's laws, however, is that they don't go far enough. I mean, we never let perfection get in the way of progress. But in Victoria, the laws that they are planning on introducing in August don't actually include the vapes, the illicit vapes. They only relate to illicit tobacco. If there are enforcement officers who go into a store, don't find illicit tobacco, but do find illicit vapes, there's nothing nothing they can really do about it. And so we've been really calling for the Victorian government to make changes to their laws to include these other illicit nicotine products. And so we're hoping that the laws actually, strengthen a little bit more to allow these other products to be seized.
I think the issue with vapes as well is the fact that they're regulated by TGA, right?
Yeah.
I'd have to look at that
I
more.
think the TGA can go in and raid a store
Yeah.
if it's got vapes, but Victorian enforcement can't because it's not in Victorian laws.
So we're talking a lot about some of the, well, let's say the doom and gloom stuff, the regulation, the laws, sending the police in to enforce this stuff. And it's right, we do need to focus on efforts in enforcement and stopping supply. But I also want to come back to the report and the top level thing, which is this is really good news. This is a good news story here. We've got a big success story in terms of both people who are quitting smoking, but also the generation of young people who are choosing to not take up this habit. So, I mean, we know that cigarettes are incredibly bad for people, but at the same time, they're also incredibly addictive. So for people who haven't yet been able to quit, what kind of supports are available so that they can join this success story and get off from smoking cigarettes?
There are still 1.2 million smokers in Australia, and it's still killing 66 Australians every day. We're not about throwing any shade at people who are using these products. They are a victim of big tobacco fundamentally, and we need to change the game there. So one thing that we are pushing for as well is in Queensland, if you are to pick up the phone to the quit line, you will get access to more support and free therapies to quit smoking if you kind of check off a few boxes while you do it. And as soon as Queensland introduced those reforms, the number of calls to the quit line just skyrocketed. So we don't necessarily have the outcomes of it yet. We don't have the, how many successful quit stories happened off the back of that. But that needs to happen everywhere. That needs to happen across all states and territories. And we're pushing for that as well. I mean, it's a no-brainer. At the moment, if you are suffering with an addiction to tobacco, you can go down the road and purchase an $8 packet of illegal tobacco, or you can go into a pharmacy and your combination nicotine replacement therapy would cost you, maybe over $100. We've got it the wrong way around, really.
In addition to that, and of course that report is yet to be released, the final recommendations and so on to government that's in train, but what have you seen has been the reaction of tobacco and its allies to this good news from the AIHW?
Yeah, I mean, it's interesting because unless Laura's seen something that I haven't seen a lot from big tobacco. They've been suspiciously quiet at this good news, which kind of makes sense, right? It's not the news that they were hoping for. In terms of their retail sector allies, though, we have seen some media releases go out calling into question the results, calling into question the AIHW as an organisation. We've also seen some politicisation of the issue and some MPs come out and also question the survey. The interesting thing about that is that these individuals have relied on the survey for years to sort of frame their own argument about vapes and tobacco and all of that sort of stuff. And it's interesting that when the results come out that aren't the results that they were hoping for, all of a sudden the survey, doesn't make sense and we need an independent review into it. So it just goes to show like the way that the industry and its allies try to cast doubt whenever there is something that comes out that they don't like the sound of, they always try and attack it. That again, that very same data that they've been using for years to claim that, vapes help people quit and all of that sort of stuff. So we're seeing a lot of doubt from the industry, despite, us actually being really explicit about what the difference is between the ABS and the AIHW and how they're quite complementary. They still seem to be throwing their toys out of the cot when it comes to this issue.
We have around 40,000 tobacco retailers where you can legally go in and purchase a packet of cigarettes. Now, that servicing 5.6% of the population who are smoking daily, that is oversupply on steroids, right? You cannot have that many shops. And as we start to cut it down, as we start to reduce the number of retailers, we need to do it in a really smart, strategic way. So at the moment, you have a number of key groups who are legally licensed to sell tobacco but are not doing anything illegal. They're not breaking the law. They're not selling to anyone underage. So we need to start thinking about the type of businesses that are not engaging in the illicit trade and why. And the reason is they have strong governance systems. They have major consequences for their business model if they are ever caught doing anything that breaks the law. And we need to start thinking about transitioning our tobacco retail environment into an area that is safer, more secure, and will help enforcement in the long run.
We know that industry and its fellow travellers are ready to push back on this success story. We have the press club on Wednesday, and we have a bunch of people who are going to stand up there and call for cuts to the tobacco excise. The national broadcast is going to be giving space to these people to make these calls in the face of what we see is a decline in smoking. What do you make of this particular scenario?
Incredibly problematic. Criminals selling $10 cigarettes don't pack up and go home because the price of legal tobacco reduces. Making all cigarettes cheaper will just mean more people smoking and more people dying from this. And the National Press Club is going to be a really important event this week because it gives them a platform to, take apart one of our most credible, reputable agencies and surveys that we've been relying on for over 30 years now. We need to make sure that that is counted in a big way. No rest for the wicked, people. No rest for the wicked.
I think this also comes back to what I was saying earlier around the politicisation of health in Australia. It's no longer just helping people who smoke to quit and making sure that our supply chain is appropriately reformed. It's political point scoring. And if they get up on stage and they talk about or they discredit the ARHW finding, it's not just the ARHW findings that they're discrediting, because we've seen those same findings across multiple state-based surveys. So they won't mention that. They won't mention that the survey is consistent with what they've found in South Australia and in Queensland and in New South Wales, because it doesn't fit their rhetoric, right? It's much better to get up and say, well, we can't trust this survey, as opposed to we can't trust the last 4 surveys that have come out. And unfortunately, if we aren't there or if we aren't given the opportunity to have a right of reply, then that misinformation goes out into the world, it goes out to journos and it gets reported on. So hopefully we've done enough what we call pre-bunking on Friday ahead of the Wednesday National Press Club to lessen the impact of that misinformation. But as Laura said, it's hugely problematic that these people are being given a platform to spread this misinformation.
Michelle, Laura, thanks so much for sharing your time with us this morning for a quick reaction to the report last week. I guess we'll all be watching the press club on Wednesday and the fallout from that. And hopefully people have been supplied with enough pre-bunking to watch with some sort of skepticism. So thanks for joining Paris and I for another episode of Public Health Is.
Public health is the special sauce.
Stopping bad things from happening.
Public health is the special sauce.
Stopping bad things from happening.